just inspecting her before I even touch or do anything. I'm just going to look at her, make sure everything is bilaterally symmetrical. No subventricular or subclavicle accessory muscle use of any sort. How her breathing is, if it's effortless or if she's having difficulty. Looks like it's good. So, and then I would start by palpating her chest. So I can start in the front, and you want to watch their face too. For any discomfort. And then palpate the back. Percuss on the back too. Also, while you were palpating, you're going to make sure there's no tactile firmness, no tenderness or discomforting, and listen for the dull and ruminant sounds. And I would actually then take my stethoscope and I would listen to her. And then also fill up here. Percuss. Okay. And then moving on to the pericardium areas. So you're going to want to listen to the aortic, pulmonic, Erb's points, tricuspid, and mitral valve, and then you look for the maximum impulse. So you want to turn around. So first you're just going to inspect them, make sure nothing is visible. You want to feel her pulse, her carotid. Make sure it's not bounding or anything. Just go ahead and palpate those points. Make sure no discomfort. Again. And the mitral comes out the mouth. Okay? And then after you palpate, I would then take my stethoscope and listen to all those. Aortic, pulmonic, Erb's point, tricuspid, and mitral is where I would listen to. I'm making sure I hear the S1, S2 sounds, no other sounds in there. And then, let's see. Look at her hands. Make sure they both are pink bilaterally, warm. Check her capillary fill. Already put at the maximum impulse and listen, so that's good on that. And then moving on to the abdomen, you would lay down. Okay, so then I would just look at her belly, make sure there's nothing abnormal, you know. It's all just equal, bilaterally symmetrical. You can start by palpating in all 9 quadrants. Make sure it's no discomfort. And then deep palpation. Have her exhale and then inhale. Define those organs. And the liver would be up here, and everything else over there, and bladder down there. And then I would listen to the bowel sounds in the 4 quadrants. And then I would listen for the aortic, abdominal aortic. So listen to that right here, and then the kidney, the renal make sure everything's equal. No masses found, everything, checking it bilaterally. And then I can go ahead and listen to her lungs. I listen to her anterior and posteriorly and laterally. So I listen to her in her front all the way down. And then also back here posteriorly. And checking to see how she's breathing, if she's using any accessory muscle use. Checking it all the way. Listening for a full in and out. Seven places is where you would look for it. Just looking for any sort of any wheezes, crackles, bronchi.